So hi everyone, and thank you so much for joining us for our webinar today. My name is Hannah Wells, and I am the Knowledge Translation and Intervention Coordinator with the Temple University Collaborative on Community Inclusion. Thank you so much for joining us today as we learn from Stephanie Orlando and Vicki Smith through an introduction to Centers for Independent Living, fostering collaborations between mental health advocates and Centers for Independent Living. I'm going to first hand it off to Dr. Mark Salter, who's the director of the collaborative, who's going to do a brief introduction, and then Vicki Smith, the director of the Alliance of Disability Advocates, and Stephanie Orlando, the chief operations officer for the Western New York Independent Living, will take it from there. So Mark, I'll hand it off to you.
Great, thank you, Hannah, and thank you for your all the work that you put into helping to organize this event. This is a conversation that I've been really interested in having for like the last 25 or 30 years that I've been working in the mental health field. I have been a longtime admirer of Centers for Independent Living over the years. I was originally introduced to them by Pat Deegan in an article that she wrote in 1992 that talks about, and I just put this in chat, and if anybody would like a copy of it, you can send me an email. But Pat used to work, she's very well known in our mental health field as a person with lived experience, an advocate, one of the most brilliant people we have around. And Pat really made the argument that Centers for Independent Living really could play a very critical role in mental health service delivery and in the promotion of recovery of people with mental health issues. Some of you may or may not know that Centers for Independent Living really focus on the rights of people who experience disabilities, including people who experience mental health issues. Some of their core services are advocacy, peer support, information and referral. And what you'll hear in a few minutes from Vicki and Stephanie is they do so much more, including things in the mental health space as well. I should also mention that I've worked with Joseph Rogers for a long time as well here in Pennsylvania and Philadelphia. And Joseph also had a strong background in independent living philosophy. So I need to give credit to him as well. Here in Philadelphia, I've had the opportunity to work with Liberty Resources, which is our Center for Independent Living here in Philadelphia. And over the last, gosh, Vicki, I don't know, 4 or 5 years, something like that, I've been fortunate to work with Alliance of Disability Advocates in Raleigh to support really one of the most novel initiatives that they have going on with the State Office of Mental Health and different providers in North Carolina to really support the community inclusion of individuals who are moving out of large adult homes into independent living. And I think their supports are essential. So you've heard more than enough from me already. I think the exciting part of this is hearing from Vicki and Stephanie. So I am going to turn it over to, well, back to Hannah, and then she can move it forward.
Great, thanks Mark for that great introduction. Stephanie's actually going to start us off with some history of the Centers for Independent Living movement. So Stephanie, I'll pass it over to you.
All right, well, good afternoon, everyone. I'm excited to be here today and good to see some familiar names in the list there. So we're going to kick us off with just talking a little bit about the independent living philosophy and what it's all about. So independent living really started from the idea that disability isn't a problem, that really the built environments and the attitudes, the attitudinal barriers that we face, those are the problems. And that really we as people with disabilities are just part of natural human diversity and should be celebrated. And we'll talk a little bit more about disability pride and where that kind of comes from as well. Independent living emphasizes that it's run for and by people with disabilities. So the idea that we're peer run, we use the word consumer, and I'll talk a little bit about that again as well in a bit. But we really promote the idea that as peers, we can understand and help people navigate through complex situations better than other people, and do it with the dignity and respect that people deserve. In fact, we promote the idea of dignity of risk and the right to fail. The idea that we don't have to protect people with disabilities from themselves, that we can have a future that we dictate for ourselves and decide things for ourselves and take risks. We don't have to be overprotected and parented to a level where we can't live a full and meaningful life as we determine it. And the idea of interdependence, where people, independent living is really about finding the supports that work for you. And really living independently in the community does not necessarily mean living on your own. It means finding the supports that work for you and working with others to achieve that community living that you most want to achieve. Okay, you can go forward now. So some of the pioneers of the disability rights and independent living movement are listed here. We have starting with Justin Dart. Justin Dart is widely thought of as the father of the Americans with Disabilities Act. He was born into a really wealthy family and then contracted polio and traveled the country, and really the world, listening to people with disabilities and what their stories were. And he promoted the idea of love for all and justice for all. And he really pioneered with his wife Yoshiko, bringing the voice of people with disabilities to government officials and making sure that was known. And he, of course, as I mentioned earlier, that work brought forward the Americans with Disabilities Act. Next is Judy Heumann, who you may have seen through Crip Camp on Netflix or Drunk History on Comedy Central. She recently passed away in 2023. She is really well known for all of her disability rights work, primarily too with the 504 sit-ins, and we'll talk about that in a little bit. Was really her start of being very famously known for creating the standards for independent living. That was one of the big things that came out of the 504 sit-ins. Ed Roberts is considered the father of independent living. He started the first independent living center in Berkeley, California, and really was a disabled student at the University of Berkeley University, and fought for the rights of himself and others on campus. Originally, he was going to be discriminated against and not allowed into the school once they discovered his disability, but that was overturned. And he did a lot more as he stayed there. And then Pat Figueroa, we here in New York especially like to acknowledge Pat. He was the first one to start an independent living in New York State, and one of the first ones in the country, again, because that was really just getting started when he put the first center here in New York. So you can go ahead. So I mentioned the 504 sit-ins. This really was about pushing the Rehabilitation Act, which is where most of the standards and key pieces of what an independent living center live. So in between 1973 and 1977, there were no regulations issued. So this law was on the books, but it had no weight behind it. People had different ways of interpreting it, making decisions about it. So really the disability community came together and said, we need to have regulations and standards and understand what this law really means to put it in place, because it really was talking about that you could not be discriminated against in accessing any government services if you had a disability. Like everything had to be accessible. So it was a big deal. It was, pre-ADA set the tone for that. So that contingency was over 200 people sitting in for over 26 days and creating the standards and pushing them forward in the government so that they would be adopted and created what independent living is today. Keep going. All right, so I mentioned the word consumer and that we would talk about it. It's important to know where that comes from in the independent living world. I myself am a person with multiple disabilities, including mental health disabilities, and I hated the word consumer before I worked here in an independent living center. I just thought it meant we all consume and we don't give. There's a lot of different feelings about it, and I felt it was really important to learn the history and know where it came from, and that independent living really embodies what it is meant to be, which I think a lot of times people put the cart before the horse in the using the word consumer, where people really didn't have choice. It was just a label that different from patient. But where it came from in the independent living movement is really at the time where independent living was starting. Ralph Nader and that whole consumerism movement was really taking off, and the idea that people who are buying products should have a say in their design, should have a say in what they uh, what quality, and knowing about the information, all of the information, but really having that choice and buy-in in even developing products. So in these standards that were created out of the independent living movement and those 504 sit-ins are really the idea of consumer direction, that all independent living centers need to be run for and by people with disabilities. Consumer is the word used in the standards. It's used in our government site visit standards. But again, what that really means is that we're run for and by people with disabilities. And not all centers still use the term. Some have moved away, but in terms of like government reporting, we have to use the word. So you will see it as you encounter independent living centers.
Thanks, Stephanie, for sharing about the history of Centers for Independent Living. Vicki, do you mind telling us a little bit about the core services that CILs can offer?
I'd love to do that. So there are basically, first of all, let me say that if you know a center, you only know one center, but we do all of these things, but they're not identical from center to center or state to state. It really is dependent upon the individuals that we serve, the board of directors, and staff. But we provide, first and foremost, advocacy, and really this means helping people learn how to advocate for themselves. So we try very hard not to do things for people, but help them learn how to do it for themselves. In our agency here, we do an awful lot of information and referral. We make sure that our website is up to date and that people can go there and get information independently of waiting for us to answer the phone. We help people transition from living and or participating from one stage of their life to another stage of their life. And when I use the word stage, it's not just age related, it's how someone's life changes over time. So we work with transition. We also do an awful lot of independent living skills training. I can remember when I first started at Alliance of Disability Advocates, one of the people who worked here was, I'm a short person, I'm 5'2", he was 6'2", and he came in and sat down and told us in the staff meeting that his consumer wanted to learn how to cook. And in particular, the consumer wanted to learn how to make spaghetti, I believe. And Sharif didn't know how to do that. So he had to roll up his sleeves and work and teach himself, as well as the person he was working with, how to make spaghetti. I've never actually tasted his spaghetti, but he was pretty proud of that whole process. And then there are peer relationships, and you'll notice on your screen, if you can see it, that one pops out a little bit, and that's because it's the foundation of who we are. We are run by and for people with disabilities, our board, our staff, and peer relationships are critically important in that, in this environment. Next slide. So I already talked a little bit about this. I have a tendency to get ahead of myself, but if you know one CIL, you know one CIL. Even in a state, centers are going to change from one place to another. It depends on our board. It depends on how active staff might be in finding other funding sources in order to expand our work. Differences in the community are based on the needs of the community. Our board of directors is made up, in our case, 3 out of 4 people serving on our board have a disability. And we also look at the terms and conditions of funding that we receive through grants, contracts, donations, or fundraising. But always, even when we're applying for a grant, the principles of independent living are the driving force of that application. Next slide. So examples of things that we do, and again, if you know one center, you know one center. So really take time to look, go to the web, look in New York, and find out all of the different kind of things that centers do. But we, first and foremost in our agency, we help people find housing and shelter, and how to stay in their own home and learn the skills that they might need to do that. There's some rehabilitation technology that goes along with that. And that will vary from, again, from individual to individual. Mobility training is often a big activity. I know in our center, we do travel training, which is teaching people how to ride a city bus. Services and training for individuals differ depending on their cognitive ability and or any sensory disabilities that they might have. So it is, again, tailored to the individual. And then personal assistance services, identification of housing, recreation, transportation, or other support services. And this comes out of the idea that the individual with a disability has goals, dreams, and desires. And part of what we do is we help them identify what those are, articulate what they need, and then we help them learn how to find services and activities that meet those needs. Probably the one thing that we do the most of is that we provide an awful lot of information on our website. And if you want to check it out, go to adaNC.org, www.adaNC.org, and you can get a sense of just what one center does and how diverse that might be. Next slide, please.
Great. Thanks, Vicki, for filling us in about the core services and making sure that we all understand that when you know one center, it's just one center. Stephanie, can you speak to us about how centers for independent living are related to folks experiencing mental health challenges?
Yes, absolutely. So I want to start off again by stressing that centers for independent living centers, they are for everyone. This picture here I stole from the National Council on Independent Living Nichols conference website photos from 2023, this past year, and I have another photo from them, and I just want to make sure to give a shout out because I feel like that's important with stealing photos and for you to know that they're current. So, you know, we really work against the idea that people all have to function in the same way, and that, you know, again, that disability is part of natural diversity of people is something that we promote. And so we serve people with all disabilities, whether they're blind, deaf, have a mental health diagnosis, a developmental disability, traumatic brain injury, substance use disorder. I feel like that's important. Not everybody recognizes that that can be a disability, and it can, especially if it affects your daily life. And that's really the definition, is a disability that affects one or more major life function. And we do this for people of all ages. And so, of course, we include, like I said, those behavioral health disabilities, whether it's mental health, substance use disorders, and we have some specialized programming for that. But also our independent living specialists, they're meant to work with people of any disability, any age. All right, you can go ahead. So just to kind of bring again a little snapshot, this one's from New York, and I see Lindsay Miller is on here. She's our executive director of our statewide association, and I took this information from her, that independent living centers in New York really have served over like 23% of the people we serve have mental health disabilities. So when you think of that, that's pretty substantial. It's not like, oh, this is new for us or just a small amount. That's almost a quarter of the population that we serve. And, you know, as the graphic says, we serve over 100,000 people, you know, within our state a year. So that's a substantial amount of people. And, you know, our most common ones are information referral, peer counseling, benefits advisement, and advocacy. So I know, I think on the next slide, I have, well, coming up, I talk a little bit about mental health peer connection, and I'll share, Kevin Smith is on as well, and he's our director of that agency. And I'll share some examples of how we, you know, really tailor those services specifically for people with psychiatric disabilities, mental health needs within our family of agencies. So if we go on to the next one. So I mentioned earlier that I would talk about disability pride, and it really is that idea that we as people with disabilities are here, and we're not afraid to be seen and we want to be accepted and integrated as part of our communities. We are very important parts of our community. So we went from, this first picture here is of the cover of the book Ugly Laws, which talks about laws that were on the books up until you know, more recent years, within, you know, certainly a lot of our lifetimes, where they said people, they're really called unsightly beggar ordinances. So they said that people with disabilities shouldn't even be seen on the streets. Like, we should just be locked away in facilities in our families' homes, and that, you know, we were unsightly, you know, and I'm a person with an individual disability. So, you know, that's a little, it's a lot to imagine that people would be, you know, basically just locked away because they didn't want to be seen. But that's where we're coming from. And the idea of disability pride, that, you know, we have a right to be in our community. We are contributors. We have a lot to celebrate about that human difference. Is important. And so the pictures here after that are one, the disability pride flag, which it has a special meaning that I'm not going to get into all the colors and what they mean, but you can look that up most certainly. And disability pride parades in New York City and here in Buffalo. And actually the pictures of the people in the yellow shirts are from our mental health peer connection group. And, you know, we do a celebration every year, not always a parade, but we do a festival since COVID anyway, to celebrate again who we are and what we can contribute to our communities.
Great, thanks, Stephanie, for discussing how CILs can relate to folks experiencing mental health challenges. Vicki and Stephanie, to help us fully understand them, I think it would be helpful if you could explain what are some specific services and supports that your respective agencies provide to individuals experiencing mental health challenges. Stephanie, do you want to start?
Sure. So I mentioned mental health peer connection in their logo at the bottom. It was my little reminder. So we have a variety of programs that are funded through state reinvestment dollars, through our county, through federal grants that specifically work with people, as I said, with mental health needs. And that terminology can change. We're not married to one of them. We understand that language matters and that people have different feelings about the terms they use. So when they call us, if they say like, you know, I'm a trauma survivor, that's good enough for us. People come through our intake department, they give us a call, they say, this is who I am, this is what I'm looking for, and we help them. We don't need any medical documentation or anything like that. We take people at their word and we help them. So we have programs for work support, which it helps people find jobs and create resumes and build their long-term, you know, employment skills, whether they're soft skills or more technical. We help people throughout that process. And that benefits advisement piece is key, because sometimes people are afraid of losing their benefits. They need their benefits in order to access healthcare. And so that's a component of the program as well, where we help people navigate what their entitlements are and what they're responsible for. We also do have life coaching, which is what peer support. So we help people through all different life obstacles, a lot of which is housing. So social determinants of health is a big piece of what we do. And we also have a hospital diversion program, which is somewhat new and one of the first of its kind to be co-located in a same building as peer-run respite centers that from a partner that we have through Recovery Options Made Easy, and also a stop-in mental health clinic, which is through one of our clinic providers here in New York, Spectrum Health and Human Services. So we partner alongside traditional care. We have peers that are working within the hospital that has a CPAP here on the psychiatric unit. We have peers in the emergency room talking with families and people that have just experienced overdoses. So we really work alongside traditional care, but also really help people navigate so that, we're not just the peers like coercing people to take their meds. We're here to say, what's going on with you? What's working, what's not working? What do you need help with? Do you need help building your self-advocacy skills? Because that's something we could do. Do you, need someone to walk the path with you? Because as all of you know from the peer world, that's what peers are. We're the same in the independent living movement from that respect. We really are using our lived experience to help people navigate through complex situations.
Stephanie, you also mentioned something to me in the past about cornhole and connections. Do you mind speaking to that a little bit?
Yeah, sure. So one of our programs that is funded through federal dollars, actually through the opioid response funds, the statewide opioid response funds, SOAR, they have created a cornhole event where basically we promote the idea that you can have fun activities that are sober activities, that don't include, the quote I use, actually, sorry for stopping mid-sentence, but the quote I like to go on a lot is one of the participants said, I've never played cornhole without a beer in my hand. And that's really kind of what it's promoting, the idea that we could do social fun things, connect with peers. They can access that peer support long-term after that event, and really helps people also transition out of an institutional setting. That's a big thing that independent living centers do. As Vicki mentioned, it's a core service. So whether it's a rehab facility or a nursing home, those are the types of things that we have peers involved in. And frankly, you'd be surprised how many people with mental health disabilities end up in nursing homes and stuck there. And we do a lot of work to help people connect out. So we will go in and do tossing and testimonies right in rehab facilities. We also have some programs where people go into nursing homes and help with those transitions and all sorts of others. So I'm talking about two things at once, but just trying to remember that other little piece that I forgot from earlier.
Great, thanks, Stephanie. Vicki, do you mind sharing with us more about what Alliance of Disability Advocates does to support individuals experiencing mental health challenges? And you're on mute.
Okay, sorry about that. So I'll try to make this a shorter story. But in North Carolina, the protection and advocacy system used their authority to go in and find people, and they did, and they ended up making a complaint to the Justice Center. They came in, they did their investigation, and essentially ordered North Carolina to specifically set aside resources to help people with mental illness move from institutional settings into the community. And one of the, and that's how we got started with Temple University, is that there was some curiosity about if this model would work. But what we do is that we do in-reach into facilities. We talk to people with mental illness. We find out what they would like to do when they moved back into the community, and then we develop an individual plan for them to do that. And that has been pretty successful. Only 3 out of 4 people, not only 3 out of 4 people that we work with retain their housing, which is a really big measurement in North Carolina. 3 out of 4 people retain their housing. These are people living with a mental illness, and we do that by providing them with a host of services based on what they want to do in the community. So the idea is that people are more successful in staying in their own homes if they are connected to the people around them. So we do things like travel training, develop peer support groups, just a host of things. It's all individualized. And every person that we've hired to work in this program, because we get extra money that comes to our center just to do this work, is someone with lived experience with a mental illness. Sometimes that means a family member who has a significant mental illness. Sometimes it's the person themselves. And so the whole idea of peer support is grounded in Centers for Independent Living. And I could talk about this forever, but I want to make sure there's time for questions and answers.
Thanks, Vicki. So Vicki, you're located in North Carolina, and Stephanie, you're in New York. A lot of folks who are on the call today are from other states and other areas, and I did actually see this question come through as well. But Vicki, can you tell us about how individuals in other areas might be able to find out about Centers for Independent Living in their area?
Sure. So every state in the United States has a state independent living council. So type in the name of your state and then type in state independent living council. And you should be able to find your state level. And I'm sure will have something on their website to tell you where the centers are. And I have a copy of the centers on this board over here. But that's the best way. Or you can go to ILRU, which is an organization that keeps track of all of the centers for independent living across the country and make sure that we know what we're doing. They're not our bosses, they are our helpers and peer support. And you can see on the sign there a couple of links for you.
Thanks, Vicki. Stephanie, can you tell us about how folks may be able to connect with the Centers for Independent Living near them?
Sure. And I saw that in it also in the chat, and I'll just kind of answer. So there's a number of ways. One, obviously you find out who's near you, because as Vicki mentioned, you've seen one center, everyone's a little different, and they also aren't in every county. Unlike mental health peer work, independent living hasn't really seen the types of increases in funding, unfortunately. Historically, like we definitely get more of those COLAs and things in on the mental health peer side and in our work that we do. So it's really important to find out what's out there. We are always looking for people with disabilities to serve on our board of directors. There's other committees and task forces and things we do in the community to get involved in. I know that Vicki, I think you were going to speak about the mental health block grants and getting involved there to make sure that when dollars come out for mental health, that we think about the ways that we can collaborate with independent living centers. A lot of what we do, as I mentioned before, are those transition points. So if you're a traditional mental health provider and not a peer agency, thinking about those ways that we can partner, as I mentioned before, how can we come in and work with you to help people transition successfully to other parts of the community, to work, whatever the case may be, finding housing. We do a lot of that social determinants of health work that other agencies don't have the time for and maybe not the expertise in. we were asked at one point, like, why would you work with an independent living center for housing stuff? And, you know, because of the volume of calls we get, if we have a lot of relationships with the landlords and we know where the accessible units are a lot better than other places, you know, we work alongside people. We don't do for, and that's another reason why people really enjoy partnering with us, is because we help people build skills for themselves and help and build self-help and those kind of you know, long-term supports that people can come back to. People can leave and come back to us. So how can we partner for those better outcomes? And another a piece of this that I like to promote is that the peer movement, for those of us that are in the peer run centers, is really under threat a lot by now these traditional providers that found a new funding source is available for peer work. So in the chat, one of the questions was around our credentialing. So in New York, we do have credentialing for mental health peer advocates, as well as for addiction recovery peers, and they do have to go through a certification process, and that's important for us to be able to bill Medicaid for services that we have adopted in our state. So it's a requirement. All of our peers are certified. We also do go through benefits advisement certification. So we'll send people to get benefits certified if that's their role, where they know about all of the entitlements and they have to go through that certification process. And it's quite costly, especially with our turnover that everyone is experiencing, it seems now. So really that idea that, you know, you should find a center, see what we could do to partner up, because there's lots of research around the value of peer support. So if you don't have other peer providers in your area, definitely seek out independent living, because that's where your peers are. And then if you do have other peer organizations in your area, if you work for a smaller peer organization, you know, maybe team up. We like to say, buy it, don't build it, when it comes to the traditional provider agencies looking at peer support, meaning like contract with us and we'll come in and provide that peer support. That way the peer has the culture of what it's like to work in that independent living philosophy, that peer philosophy. And the same is true, I think, with smaller peer-run centers teaming up together, where, you know, there's power in numbers. If we partner, we have a better chance of survival and advocating for peer-run to stay peer-run and to be independent, and really help people, again, as independent advocates that can navigate through those complex situations and finding those traditional providers that work for them. So, you know, I think it's really important, again, to just see what's out there, because one more time, you see one center, you see one center.
Great, thanks, Stephanie and Vicki. I appreciate you filling everyone in on how they can find and partner with some centers for independent living that are out there. So now I'd like to ask you both what you would like to do more of with mental health agencies. Stephanie, we can start with you and then we'll pass it over to Vicki.
Okay, well, I may have jumped a little bit ahead in this and say that, yeah, some of this I just previously mentioned, so I'll focus on the stuff that we haven't. But that first piece of that integrity of peer support, that's where I'm saying that was just speaking on a little bit, but I want to emphasize it, that the peers that we have are really meant to work through those complex situations with the person, not, you know, oh, a peer is more likely to keep you engaged, so let's send the peer out and they'll get them to do stuff. Because sometimes we face that in those traditional models where because the research is out on the value of peers keeping people to go to like their second, third appointment, it's like, well, you're going to get them to go. And that's not what we do. We work with people. Often we do get them to go because we handle like, or help them work through those situations, like maybe the barrier is transportation. But we don't get them to go, you know, in that kind of manipulation or the word's escaping me right now, but coercing people into doing things. That was it. So that is really important to know, and we will work together with anyone and maintain that integrity that the peer movement has. We also make sure that there's lived experience and on all levels of our governance. So I mentioned mental health peer connection earlier. There, as disability independent living centers, all independent living centers are run for and by people with disabilities of any disability, because that's what we're for. But our mental health specific program is an agency, is really run for and by people with mental health diagnoses and who live in the area that we serve. So we really promote that idea of, again, nothing about us without us. It's run for us and by us. That's really important, that understanding of, we know what it's like. We should be able to design and run our own programs in according to what we think is going to be most useful. And we can have the research to back that, but we're going to design it. And that dignity of risk that I mentioned earlier, that idea that we can try things and succeed or fail, but that's up to us to take that risk. I touched on the peer run. So the other thing that I haven't really touched on too much is that advocacy and civil rights. I know that we were told that a lot of part of this audience is are advocates for the rights of people with psychiatric disabilities, again, whatever label you prefer. And as Vicki mentioned, one of our core services is advocacy, and that's really on an individual level or on a systemic level. We do a lot of advocacy. Some independent living centers will sue the government and have been successful at it. They'll sue Uber. You know, fighting for our rights is a cornerstone of who we are. And so as a partner, that's a huge area of opportunity as well. You know, again, each center is different, but some of them, like somebody mentioned in the chat, Sydney, Center for the Independence of the Disabled of New York, in New York, I'm pretty sure that's what their acronym stands for. They've been known to sue New York City over a number of things, the transportation system. I can't think of a few off the top of my head other than they're suing around accessible transportation in New York City. But we bring our voices to all levels of government. We have advocacy days. We have a huge opportunity to partner as it relates to not only getting laws and things passed and getting those budgets in from our governments, but also just making sure that things are enforced. Like when it comes to the ADA, it's only as real as the enforcement of it, as people make it. And so we do a lot of education and awareness around things as well. And that's a great area for us to partner.
Great, thanks, Stephanie. Vicki, do you have anything you'd like to add here?
Well, I think really what we're talking about is that centers for independent living really need to be aware of what's like individuals do, need to be aware of what goes on around their organization and around their community. And I can't stress enough making sure that the organization itself doesn't become isolated, but maintains relationships with people. I know that during the pandemic, we got used to doing things remotely and not going out in the world. We're starting to go back out in the world, and I mean, but things have changed so much that we're relying more on Zoom or platforms like this. So I think it's really important to make sure that we show up at other people's meetings, talk about it, and staff here, you know, and including myself, talk about our own struggle or successes living with a mental illness, not to be inspirational, but to let people know that it's safe to talk about that. I think early on in the disability movement that people with mental illness were a little afraid to talk about that for fear of not being perceived appropriately. You know, that we were dangerous and crazy and those kind of things. And forgive that language, but the point is, I think part of the success of our mission is that we go out, we talk about and say, I'm a person with a disability, and you know, I'm executive director of an agency, and I hire people with disabilities who go out and talk and help more people with disabilities. And there's a word for it, and I'm escaping it, but we're passing it on all the time. And it's that constant recognition and outreach and connection that we need to have as a community organism. And so here we are.
That's great. Thanks, Vicki. Thanks, Stephanie. I think that brings us to the end of what we had today. And so now we have time for any questions that you guys have. Stephanie and Vicki, I have noticed a few questions in the chat. So if you guys want to check those out and see if either of you can tackle those.
Sure. I think a couple of them I already addressed, like I don't know if Vicki, you wanted to address the but when the last one is, when you talk about partnering with mental health organizations, what kind of project or program partnerships do you envision? So I mentioned earlier our new what we're calling the Kirsten Vincent Respite and Recovery Center, and we our mental health peer connection program runs a living room model, although we aren't holding fidelity to that model, but that's a model that's out there. The living room model, where it's a crisis diversion program. So peers meet with people in a setting. For us, it's a living room and a kitchen, and you meet right at the kitchen table, and then in the living room, and get peer support and access to a nurse as well, who can do a more medical evaluation. That partnership in that center, though, has a clinic right there. It has another peer-run respite center. So different centers can be doing different things with peers that can be housed in the same building, work alongside. That's really important. We currently have peers that are also under contract, which I mentioned are working with the hospital, but we also have peers in their outpatient clinic. So they're contracting with us to provide the peer services that they can bill for as a clinic, which is huge. So that goes to that buy it, don't build it thing that I mentioned earlier. Like, the clinic came to us and said, we don't have an expertise in peer services. You do. We know who you are. We like working with you. We want to contract with you to employ the peers. So we provide the supervision, the regular support, and we work in partnership, where they're caring about their billables just the same, but there's a big dialogue between Kevin Smith, who's on this webinar, the director, and our contacts that are running the clinics. And so we could be doing a lot of work like that. Same with just working alongside, but independent. So maybe, you're working with somebody that has more social determinants of health needs, those daily living kind of things, and it's outside your scope. Well, that's something that an independent living center could be able to help with. Vicki mentioned earlier the learning to cook. It could be learning to use transportation. We do a lot with that. All those kind of things that are outside your expertise, or maybe you don't have time for, or aren't one of the billables. That's really a great way to partner with an independent living center. I don't know, Vicki, if you had other things to add to that.
I think that partnering with everybody, finding partners is, I think, going out and talking to people, attending other organizations, going to the Developmental Disabilities Council, for example, which is like the mental health block grant in many states, and talking about living with a mental illness, working with people who have a mental illness, hiring people who have a mental illness as peer support. All of those things are, I think, what we're talking about. And how you do that is you just, I guess, I don't know, I just go out and talk to people. And we send people, our staff, out in the community and talk about people and what we do. And in terms of getting money to do that, like any nonprofit, we do fundraising. We have fundraising events. We do promotions. We do fundraising on Facebook. we're a nonprofit and we're not shy about it. And so there are lots of different ways to raise additional money. I don't know. I wish I had a magic a formula for it, but I think it's, you just talk about it and say you need more money to do more.
Yeah, and I see in the chat the question about CMS, and that's another source of potential funding. So my personal experience with that is a couple of things. One, I met with CMS when I was on the National Council on Disability to educate them about peer services. There really was a lack of knowledge, like no knowledge, and the National Council on Disability connected me with them because they knew that there was that lack of knowledge about the peer world. And the National Council on Disability plays an important role in independent living and disability policy nationwide. So it mentioned what organizations also nationally, what does that look like? There's a variety of different national groups that work around disability rights. There's a large number of them, actually. The National Council on Independent Living, though, is the main hub for the independent living centers nationwide. Not every member joins. It's a member organization. You pay dues, but there are like groups like ILRU that was mentioned a few times that offer technical assistance. So it's funded to provide that support and ongoing collaboration for centers for independent living. And then there are different disability specific groups that really focus on that and bringing them together through different advocacy campaigns, I think, has been happening. And really, in my experience with the National Council on Disability, that happens a lot through those government committees that convene people. But then to move the government, there's other branches that then come together and use those public comment periods and work on specific issues, because, you know, when you think of disability rights, it's so broad that sometimes a little bit more targeted group is needed. And that's definitely been the case, I think, with educating CMS. So just bringing it back to that question too, kind of answering two at once. The other thing that was important in our state for CMS is to educate the state people that are talking to CMS. So my personal example is that I worked on the children's mental health side before I worked in the disability rights, like cross disability world, and then somewhat alongside it. But the children's world got further ahead with a lot of their advocacy than the adult world did in getting certain things approved by CMS. So for instance, our state said, there's no way we're going to get peers supervising peers past CMS. Well, on the children's side, we did. And it was really frustrating when I went to work with all ages. I'm like, what do you mean you didn't fight for that? Same with getting groups as billable. So I think it's really important that you educate the people in your state that are putting together these proposals for CMS to understand the value. Like I remember having discussions, very intense discussions with our state officials about youth peer advocacy getting approved by CMS as a billable, and them saying that the state officials saying, well, we're going to write it that the youth peer has to be 3 years older than the person that they're serving. And I'm like, well, why? What does that say? Like, what are you looking for here? You know, and that never ended up in the proposal, but those were the kind of conversations that needed to happen. So some of it's educating CMS, but a lot of it is just working with the state that's putting together the proposal to go to CMS. But that piece of educating them, any opportunity you can, educating any elected official on what is the value of peer support is really important.
And this is Vicki, just really quick, because I know we're running out of time. I think it's really important for people to self-identify. So the strongest thing someone can do, I think probably, you know, speaking from my point of view, was to take the risk and talk about my struggles with my mental illness and the good things and the bad things that happened to me as an executive director of a nonprofit organization, and just take the risk. And when you do that, sometimes the risk is scary and the results are scary. But when you do, you open up the door for so many other people to take that bold step. But I think that's probably the most important thing that we have to do, is to put ourselves out there, take the first step, and people will follow you.
Thanks, Vicki. And then I think we have time for one last question. Vicki, I feel like this would be good for you to answer, but Stephanie, feel free to jump in as well. Bevan asked, any reflections on how to address issues of ableism that arise in mental health spaces, or issues of mental health stigma and discrimination that may arise in independent living spaces?
Well, I think, following up is developing a little bit of thick skin and not taking it personally, is what I've had to do. Take a risk and be open about it. And I just have to. I think that a lot of people are afraid, more afraid of identifying as a person with lived experience and with a mental illness than, say, someone who lives in a chair, because we get to hide, and the person in the chair is seen. And we think that it might be scary if we're seen as a person living with mental illness. You can do it. Take the risk. It pays off.
Okay, well, thank you guys so much for Vicki and Stephanie for leading this webinar today. It was very informative and I appreciate it. And everyone who joined us, thank you so much for joining. If you have any questions or if you'd like to request a certificate of attendance, I have my email address here, so please feel free to send an email. I'll also be sending out the slides and a link to this recording to everyone who registered, so that will be available as well. So thank you, and I hope you all have a great rest of your day.
Thank you.